Hello, my name is Dr. Durline Brown-Manhertz, and I want to give a brief synopsis of the reason for choosing the DNP degree, which stands for Doctorate of Nursing Practice. I want everyone to know that the DNP is a degree that I am happy to have. I started my DNP journey in September of 2012, which was not an easy task. It included many busy days and sleepless nights. As far back as I can remember, education has always been a core value that has shaped and will continue to shape the course of my life. Many individuals have asked me why I chose to pursue a DNP degree. The answer is very simple. In a world of increasing team-based care and collaboration across professions, increasing the number of doctoral trained nurses is essential to ensure that patients have access to highly skilled practitioners. In clinical setting, DNPs serve as advocates, problem solvers, and role models with all other types of professionals. In practice, focus of the DNP education is highly tailored to developing innovation and evidence-driven nursing experts. For example, the DNP degree is for advanced practice nurses who want to be the very best to lead and to make a difference. In addition, the DNP education allows its graduates to gather evidence and implement change to improve patient outcomes. As it is said, nurses are the largest part of the healthcare workforce, and the practice of nursing is one of the most diverse as the profession addresses clinical leadership, public policy, and public healthcare needs. DNP is focused on practice competencies rather than the PhD in-depth focus on academic research. The DNP has prepared me to address the critical skill needed to translate evidence-based medicine into practice, improve system of care, and measure outcomes of groups of patients and communities. It provided me with a wide range of skills that any of these important nursing roles demand. This is why I pursue and obtain a DNP degree. I have told my friends and colleagues that it is the best career decision I have ever made. Many have asked me why I would put myself through so much stress, and I respond that in the rapid changing and increasingly complex world of healthcare, a DNP education permits nurses like me to use research to solve problems, making us vulnerable to employers and giving us career options. Pace University DNP program prepared me for what lies ahead in the 21st century. They prepared me to always use the three pillars of the program, namely evidence-based practice, primary healthcare, and cultural competencies as my cornerstone. I have gained a tremendous amount of knowledge utilizing the three pillars, which have created a foundation that I have used in my everyday practice to better care for my patients. Lastly and most importantly, I want to leave you with just a few takeaways about the DNP degree. The DNP is the terminal degree for nursing practice that prepares graduates for clinical and leadership roles and look at how disease progress from a clinical perspective. The DNP is a practice doctorate that ensures nurses have equal representation on the care team. If advanced practice nurses have the means financially and are capable of pursuing a DNP degree, then I will highly recommend it because it is a good feeling of satisfaction that's worth every moment. DNP graduates are able to become independent practitioners.